So first of all, the thyroid gland is an endocrine gland, and it's a butterfly-shaped gland that sits right across the windpipe. The thyroid gland is very important for normal function of the body's cells and tissues. I kind of think of it as the thermostat of the body, and it's very important. So first off, preserving normal thyroid function is of tantamount importance for patients. Now, patients do have thyroid disease, and one of those problems that patients can have are something called thyroid nodules. Thyroid nodules are little growths within the thyroid gland. Most thyroid nodules are benign growths, and it could be just an accumulation of cells within the thyroid that are basically doing nothing, or they can actually be over-functioning and causing the patient to have something called hyperthyroidism, where their thyroid gland is overactive. Most patients that have thyroid nodules have no symptoms, and that's one of the interesting things about taking care of thyroid disease. I get a lot of patients that are referred to the office with thyroid nodules, and I ask them how they feel, and they say, I feel fine. Most thyroid nodules are actually diagnosed with other modalities. A patient is having a CT scan done because they have a chest cold, or they're having an MRI done of their neck because they have cervical spine disease, and a thyroid nodule turns up. So most thyroid nodules are actually picked up incidentally. Most patients have no symptoms. Thyroid nodules that grow, however, they can actually put pressure on the esophagus. The esophagus sits behind the thyroid, in between the windpipe and the spine, which is behind the esophagus. And the esophagus is made of muscle. So muscle is very, very soft. It's not firm like the cartilage of the trachea. So patients may start to have some difficulty swallowing as the thyroid nodule or an enlarged thyroid is putting pressure on their esophagus. As was mentioned previously, most thyroid nodules are benign. Thyroid nodules that are less than 1.5 or 1 centimeters, depending on the patient's risk of having thyroid cancer, are just observed and don't need any further treatment. Thyroid nodules that are either growing rapidly or are associated with symptoms do need to be evaluated. Another reason for evaluation is if a patient is a high-risk patient, which is a patient that has a family history of thyroid cancer, or a patient who has had exposure to ionizing radiation when they were younger. Thyroidectomy is surgical removal of the thyroid gland, and thyroidectomy can be a removal of a part or the entire thyroid gland. And the reason for the extent of surgery depends on the underlying pathology. Most patients that have a thyroidectomy stay in the hospital overnight and go home the following day. Thyroidectomy is not very painful. The skin and the soft tissue of the neck is the only tissue that has to be removed in order to get to the thyroid gland. We don't have to go through a lot of muscle, or we don't have to cut any bone. So the thyroid surgery itself is not very painful. Most people have a little bit of a sore throat because there's a breathing tube that's put in place, and during the surgery you have to move the windpipe around, and that does irritate the voice box a little bit. So most patients will have a little bit of a sore throat and maybe a little bit of raspiness of their voice for a few days after surgery. I have some patients that go home and take Tylenol for a couple of days, and they feel back to normal within a week.